Hey everybody, this is Nurse Eunice with Florida Training Academy, and welcome back to Wednesday Night Live. I have missed you guys and gals, and I hope that everyone's having a fantastic day. And as we do in each of our videos, we'll give you a few moments to receive your notifications, and we will get started shortly. Hey, Jai Kim, let's see, Sashna. So many of you are already in the chats. Look, I have missed you too. So we're going to get started in a few moments. Let's see what you have. Hey, Dadu. All right, so here we go, everybody. Let's see. That's right. There is absolutely no reason for you to fail the CNA examination or the patient care tech examination. You all, I've been doing this now for 17 years. So if you just follow what we teach you here at Florida Training Academy and on my channels, you're going to pass your test. And so what I found was during the pandemic, was that our reading abilities decreased. And so I want to help you pass your examinations because I know if you can pass your CNA examination, that's going to encourage you to go further, to go to nursing school, to be a phlebotomist, to do scrub tech, whatever it is, you can do it once you learn the terminology and you build your confidence. And guess what, team? We did it. So thank you. Oh, yes, we have over 1 million subscribers, and we could have not done that without viewers like you. So I just want to say thank you. And no, we don't get any fancy trophies or awards, or at least we haven't gotten any yet, but it just shows how much you all value the content that we provide on this channel. And so I want to take this time to say thank you. So thank you. I love you. Oh, Sasha, yeah. So I just passed my written. I do my clinical. Oh, you're so welcome and congratulations. And thank you so much, Dadu. We love you also. All right, so let's get ready to start our practice test. You all, I realized that even though I had all the skills for the CNA exams, I didn't have them combined into one video. So if you're interested, if you want to use your phone to scan the QR code, you can watch all the CNA skills videos step by step. A lot of you all don't really focus on the clinical skills as much. You try to focus on the practice questions. But remember, in order for you to be a CNA, you have to pass the written or the multiple choice test in addition to the hands-on checkoff. So you can use that QR code or you can go directly to our YouTube channel. All right, question number one, everybody. A patient is in restraints. What is the CNA's priority responsibility? Is it A, ensure the restraints are tight? B, document restraint use once per shift? C, check circulation and skin integrity every 15 minutes? Or D, remove restraints only when the family visits? And then KYBL and Toledo, hi, and thank you. Right, we have some awesome answers coming in. Let's see, I'm just going to start showing the comments. So, I love the name of your channel, Baby Sleeping Music. Oh, you're so welcome. You passed both of your exams. Look, I am so proud of you, and there's going to be more like you. So, everybody, revealing the answer in three, two, and one. That's right. If you chose C, you understand that patient safety and circulation checks are the top priority when restraints are used. And so, usually during the most critical, during the acute restraint use, we're doing Q15-minute vitals and circulation checks, etc. And then, as the time goes on, when they're not in their acute state, that's when your facilities will usually change it to Q 1 hour, Q 2 hour vital signs. But in the immediate moments we put a patient in restraints, we have to check on them. All right, so question two. A resident with Parkinson's disease has tremors and difficulty eating. The best intervention is which of the following? Is it A, feeding the resident all meals? B, provide and adapt with utensils and allowing extra time? C, restricting the resident to finger foods only? Or D, offering liquids to prevent choking? Elaine, we've had so many people tell us that they've passed their PCT examination. So I know you're going to do well and good luck with your test. Let us know how you did. All right. So for this one, we're torn between B's and D's. I see some varying answers. I had to remove my camera from the screen because it was causing a delay. But yes, whenever someone has Parkinson's, look, Parkinson's is not dementia. So when they have Parkinson's, they can help themselves, they can feed themselves. You just have to give them utensils that they need. And so they have weighted utensils, they have utensils with bigger handles. The answer is B, just like you all said, it promotes independence while supporting safety. And so get those adaptive utensils. And there is a special department within your hospitals that help people with their fine motor skills. That will be your occupational therapist. And so your physical therapist, they help with the movement. Your occupational therapist teaches them how to use those fine motor skills, how to button buttons, how to feed themselves again. And also your speech therapist. So if you don't know who to talk to, once you talk to your nurse, if you see an occupational therapy or a speech therapy, ask them how you can help your patients. Plus, it'll give you some insight into those other areas because you might just want to work there. Question 3. Which is an early sign of hypoxia? I love that's like the fourth person. Woohoo! Rawa. Congratulations, dear. All right, so question 3. Which is an early sign of hypoxia that a CNA should report immediately? Is it A, blue lips and fingertips, B, respiratory arrest, C, loss of consciousness, or D, restlessness and confusion? And notice this question said an early sign, because by the time they turn blue, you all, that's a late sign. That's right, Jay and Raji and Joy. Yes, it would be D. It is restlessness and confusion. Those are early signs. Look, we need to stop it before it gets late stage, before they go into respiratory arrest. So the answer is D. Restlessness and confusion are early indicators of low oxygen. So when your patient who was previously okay, they were responding, they were awake and alert, and now they're kind of irritable, they're fidgeting, they're telling you they're seeing stuff on the walls. That could be a sign their O2 level is low. So do those vital signs, include in their O2 saturations. Question 4. Which of the following is the primary reason for securing a catheter drainage bag below the level of the bladder? Is it A, to allow the patient more mobility, B, to prevent the bag from being pulled, C, to make it easier to empty the bag, or D, to ensure continuous urine flow and prevent backflow? Hey, Vivian and Lotus Flower. Hey, Kamisha. Yes, everybody, you have it. It is up. We're torn. I see D's, but I also saw a B. And so you all, it would not be B. We don't secure it just so that the bag doesn't get pulled. We secure the catheter, the flexible tubing to make sure that the urine flows like it should do so and to make sure that it doesn't return back into the bladder. Because if that old urine backflows, we increase the chances of our patient getting a UTI. And so that was a little bit tricky. So the answer is D. And remember that positioning of that bag and also that catheter below the bladder prevents backflow, which could lead to infections. Let's go to question number 5. A CNA is assigned to care for a patient with an AV fistula, and that's arteriovenous. And so that's usually for your dialysis patients. So I'm going to repeat that. A CNA is assigned to care for a patient who's on dialysis. They have an AV fistula in their left arm. If you're the CNA, what is the most appropriate action? Is it A, avoid blood pressure, blood draws, and IV insertions in the left arm? B, place a tight bandage over the fistula site to protect it from bleeding? C, take the patient's blood pressure in the left arm to monitor for hypertension. Or D, massage the fistula site to promote circulation. And I can't believe I did not include an image of an AV fistula, but you all know that I love to give you homework. And so your homework assignment is to go to Google and then type in AV fistula and then click on images so you can see what an AV fistula actually looks like. And if your patient has one of those in their arms, oh, we're torn between A's and C's. It would be A. We don't use that. That arm is special. That arm is to be protected. No blood pressures, okay? So the answer is A. CNAs must protect the AV fistula by avoiding any procedures or pressure on the access arm. That's how they receive their dialysis. That's how we clean their blood. So we have to make sure we protect our fistula. Blood pressure checks, IVs, and blood draws can damage the fistula. And plus, you wouldn't be putting a tight bandage on any area. And so you avoid the extremity. We have to use the alternative, the opposite arm for any procedure, such as a blood pressure. Question 6, while performing phlebotomy. And so this test is not, this practice test, let me make sure I preface that. This practice test is not just for CNAs. So when you're taking your test, you can't do any of these advanced skills. But once you take your test and you pass, you can work in a hospital. And in our area, with a CNA license, if you get hired in the hospital, they teach you these extra skills and they change your title to a patient care tech. And so the base skills are the same. But for this particular question, this is for a hospital level CNA, AKA a patient care tech. All right, so with that being said, while performing phlebotomy, the PCT accidentally punctures an artery instead of a vein. What is the immediate action? Is it A, leave and immediately notify the nurse? B, elevate the arm and continue with the procedure? C, continue drawing the blood? Or D, apply firm pressure for at least 5 minutes? All right, we'll wait for two more responses. We're torn between A's and D's. But it looks like the D's have it. And so, you all, if you chose A, pretty much you let your patient bleed out because you left someone who was bleeding from an artery. If someone is bleeding, you do not leave them. You want to do D. Great job, team. And this one says apply firm pressure for at least 5 minutes. Look, we're going to apply pressure until the bleeding stops. So, how do you get the nurse in the room? While you are holding pressure with one hand, you can hit the panic button, the call lights, you can hit a button with the other, and you can also be screaming out, scream help, let them know what room you need help in. And here's our rationale. Puncturing an artery requires immediate pressure to stop bleeding and prevent a hematoma. Plus, so you're going to hold pressure and scream out, but at no point if a patient's in danger do you leave to get the nurse. You stay with the resident or the patient and then call the nurse into the room. Question 7. Which patient is at the highest risk for developing pressure injuries? Is it A 30-year-old with a broken leg in a cast? B, a 50-year-old on bed rest with incontinence? C, a 65-year-old with well controlled diabetes? Or D, a 40-year-old post surgery patient who is getting up walking twice per day? And this one's super easy for you all. I don't expect any of you to get this one wrong. And that is right. It is B. You all knew that. And so incontinence is the inability to control your urine or your fecal matter. So your patients can have urinary incontinence, they can have fecal incontinence. But whenever someone is wet, whether it's with urine or with stool, plus they're unable to move independently, that greatly increases their chance of skin breakdown, aka a pressure sore. All right, question number 8. A CNA is helping a patient who just returned from dialysis. What is the best action? Is it A, encourage the patient to drink a large glass of water? B, weigh the patient and record the result? C, take vital signs before the patient rests? Or D, change the dressing over the fistula site? I know this one's tricky because I'm asking you questions about dialysis patients. There are a lot of patients with kidney disease. So if they have kidney disease, sometimes their disease becomes so bad until we have to put them on this artificial machine in order to clean their blood. And so you're going to have patients with kidney disease. You're going to have patients who are on dialysis. What do you do when that patient returns back to the room? And if you chose the answer B, you have it. We have to weigh those patients. So patients are weighed before and after dialysis to assess fluid removal. CNAs are responsible for doing those weights. You're responsible for the accurate measurements. Once you get the weight, then we can do the vital signs. Some of your beds are super high tech. Your beds may actually have a scale in them. So you can actually get them in the bed, make sure it's zeroed out first, and then you can get their weight while they're actually in the bed versus bringing a scale into the room. But weighing is the most immediate priority post dialysis, and then after that, you can get the vital signs, unless your patient's in distress, and that's totally different. Question 9. A PCT is caring for a patient with a central venous catheter. You all, that is a catheter that is pretty much going through like a large vein. Okay, so it's not one that's going to be in the arm. This is a special catheter that was surgically implanted or inserted. So you're caring for a patient with a central venous catheter. Which task is the PCT scope of practice? Is it A, flushing the catheter with saline, B, changing the central line dressing, C, monitoring for signs of infection and reporting them, or D, administering medications through the catheter? That's right, because not all of you all are going to be working in a nursing home. Most of our students here in Jacksonville at Florida Training Academy, they work in the hospitals. They take our 2 or 4 day class and they get jobs in the hospitals as patient care techs. And they have to learn all this really quickly. And they do a great job. So if your patient has a central venous line, you're going to do C. You have to monitor and you have to be careful when you turn them. Make sure you don't pull out their catheter. So PCTs can observe and report, but they are not authorized to flush or administer medications through central lines. Oh, let's see if you know your PPE. Question 10. What is the correct sequence of actions when removing personal protective equipment or PPE after caring for an isolation patient? And this is a lot to read, so I'm going to allow you to read it. What is the order to remove your PPE? You just took care of a patient who was on contact isolation and also on respiratory isolation. Oh, you all are so awesome. I see some correct answers coming through. And you were fast with it. Yes, Nisi, Kamisha, Okafor. Hey, Okafor. Yes, it is C. And when you are in doubt about anything, like someone was asking me why their job didn't offer them 3 vaccines for hepatitis B. And I was like, look, I don't know the new rules. I don't know if something may have changed. I need you to go to the CDC's website. And so, when in doubt, go to cdc.gov, cdc.gov. And so, this image is from the CDC site. It will tell you how to put on your PPE, how to remove your PPE. And so, the correct sequence is gloves, goggles, gown, and then mask. And so that sequence, according to research, is the least contaminating for the actual caregiver. Question 11. Which of the following is outside the CNA scope of practice? Is it A, reporting low urine output to the nurse? B, noticing changes in skin color and alerting the nurse? C, administering prescribed medications for hypertension? Or D, recording fluid intake during meals? I know this one's tricky. So, in many states, you could become a medication aide after you've been a CNA for a year and after you take a separate certification. So if you are trying to take your CNA examination, you cannot, if it asks about you giving medications, the answer is always going to be no. But, but once you've had a year of experience, search your state do that's not within your scope of practice would be C. CNAs do not administer medications, but you can observe, you can document, and you can report findings to your nurse. Question 12. Which of the following is the best indicator of effective CPR? So, our patient has coded. They went into cardiac arrest. Their heart has stopped pumping. How do we know if our CPR is effective? Is it A, the patient begins to breathe independently? B, the chest rises slightly during compressions? C, the patient's color improves? Or D, a carotid pulse is palpable during compressions? This one's hard. I don't see any answers coming through yet. All right, we'll give you 5 seconds on this one. Oh, I tricked you all. You all, it's not B. The chest doesn't rise during compressions. The chest would rise with rescue breaths, not with compressions. So the answer is not B. Give me another answer. I started seeing some correct answers coming through. And so for this one, you all, it is D as in dog. And so whenever we're doing those compressions and we have a team around us, usually someone is going to be feeling for the carotid artery. And so we don't say the word feel, we'll say palpate. So it's a palpable carotid artery because if we're compressing on that hard and we're getting good circulation, that means that blood should be flowing to the brain. All right, and so a palpable carotid pulse during compressions indicates that blood is circulating effectively. Question 13. While turning a bed-bound patient, a CNA notices a reddened area on the patient's coccyx, that's their tailbone. What should the CNA do? A, massage the area to improve circulation. B, reposition the patient. C, report to the nurse. Or D, ignore it since redness is common. I can't believe I tricked you all again. I can't believe I tricked you again. It's not C. It's not C. Don't do C. What do you do first? You're in the room with a patient who has a reddened area on their body. Don't leave them on their don't leave them there. That's right. The first thing you're going to do is B. So, your first immediate action is to relieve the pressure by repositioning the patient. This prevents the redness from progressing into a pressure injury. And then, when you're out in the hall, you can notify the nurse. All right. And plus, the nurse is going to have you help her turn the patient anyway. So you might as well just go ahead and turn the patient, leave them on a pillow. It's going to make it easier for that nurse to access the wound. And so, repositioning, when you find something that doesn't look right, remember that nurse, it can take that nurse 20 to 30 minutes to get into that room if it's not an emergency. So you do what you do best, reposition, and let the nurse know when you see him or her in the hall. And then don't forget to document. Question 14. A patient on telemetry shows a sudden drop in the heart rate to 30 BPM. What does BPM stand for? Put it in the chat, please. What is the immediate action? Is it A, call for immediate assistance and initiate CPR if needed? B, increase the oxygen flow rate? C, silence the alarm and monitor? D, adjust the electrode placement? All right, so you're going to be giving me the answer as far as what does BPM stand for as it relates to heart rate, and then you're also answer the question. All right, looks like we got a few of you all. Let's see who said it first. I think Elaine said it first. That's right, beats per minute. And so if we were talking about breaths or respirations, BPM would stand for breaths per minute. But you're absolutely correct if you put BPM as far as breaths per minute. So I'm going to reread this question. A patient on telemetry shows a sudden drop in the heart rate to 30 beats per minute. That's not life sustaining, you all. That's too close to zero. And so you are right. You're going to immediately call for help. It is A. And then while you're waiting for that nurse to get into the room, if their heart rate drops slower, if that patient becomes unresponsive, you're tapping and you're shouting, you're feeling for the carotid pulse. At the same time, you're checking breathing. And if you have to start CPR before that nurse gets into the room, you will, because a heart rate of 30 beats per minute is life threatening and requires immediate intervention. That's really close to zero. And so your patient could go into cardiac arrest while you're in the room with him or her. Question 15. Which of the following is a contraindication for applying a pneumatic compression device? Those are those sleeves that you pull on the patient's legs. So, what is a contraindication? Is it A, history of varicose veins, B, active deep vein thrombosis or DVT, C, POD stands for post operative day. So, post operative day one, after a person's had a total left hip replacement, or is it D, history of diabetes? So, when we put those compression devices on a patient's legs, which patient type should not receive those compression devices? That's what this question is asking. Ooh, we're so close. We're so close. Great job, Diana. Yes. So, you all, the one that has a history of DVTs, that means a varicose vein doesn't mean that they have a blood clot. So if we put that compression device on someone's leg who has a blood clot, we could make that clot travel. So we don't put compression devices on extremities that we think have a clot in them. And so here's your rationale. The answer is B. Active DVT, deep vein thrombosis, is a contraindication because those sequential compression devices, they increase blood flow. And so they're going to be compressing on this clot. And if the clot is present, it could cause it to dislodge. And then if that clot travels to the lungs, there will be a pulmonary embolism. If it travels to the brain, the patient could have a stroke. It travels to their heart, they can have a heart attack. So, whenever we have a patient who is on DVT precautions, we usually keep that leg immobile and we may also keep it elevated if it's swollen. Question 16. Oh, all right. So this one isn't a question at all. It's reminding you that if you go to my website, my personal website, nurseeunice.com, scroll down to the bottom, you're going to see free printable practice tests, but it's a lot of information. Free CPR study guides, free phlebotomy study guides, and then we also have some CNA bundles and a medical terminology bundle for $5. And so that is separate from our regular website, fltraining.com. This is our website where you get your freebies and your resources. All right, question 16. A CNA observes a patient hiding food in their bedside drawer. What is the best action? Is it A, remove the food immediately? B, ask the patient why they are hiding it? C, report the finding to the nurse? D, ignore it since patients can have their own choices. Your patients are going to be hiding food. You're going to pull the covers back and see cookies and chips and all types of stuff. And yes, they're diabetic and they're not supposed to have it. So what do? I know you want to do A, but A would cause a argument between you and the patient. So you have to do it discreetly. So what you're going to do instead is C. You're going to let that nurse be made aware. Hidden food may violate dietary restrictions. For example, your diabetics, your patients who are on dialysis, or if they have fluid limits. And so what you're going to do is you're going to come out and you're going to tell me, hey, Eunice, patient in 352, Miss Sarah, she has Coke in there. She has this, she has that, and her diet is a low sodium diet. And so I'm going to go in, I'm going to talk to her, and then I'm going to document because the patients have a right to refuse. But I will try to re-educate her and remind her of her dietary requirements. And if not, at least we'll be protected because I will also notify the doctor. So you notify me and I will take care of the rest. Question 17. A CNA is feeding a resident with a history of a stroke who has difficulty swallowing. What is the most important action? Is it A, place the resident in a reclining position to prevent fatigue? C, give thin liquids to help with hydration? C, keep the resident upright at least 30 minutes after meals? Or D, offer large to encourage faster eating. And I'm not sure why. All right, and they can see the questions because they're giving me answers. So, yes, Diana and Ashley and Stacy and Okafor, yes, you have it. It is C. Keeping the patient up. And we're going all the way to 25 team. I appreciate you all and thank you all for studying with me. So, question 18. A CNA is caring for a patient with low platelets. We call that thrombocytopenia. Say it with me, thrombocytopenia. What is the appropriate action? Is it A, use a soft toothbrush for oral care? B, provide a straight razor for shaving? C, encourage the patient to floss daily? Or D, massage bruised areas to improve circulation? So that means that you got to learn about these different patients and patients with blood ailments and blood disorders. Correct, Raji. I don't want to mispronounce your first name, so I'm just going to say your last name. So it is A, everybody. So I'm teaching you something new today because we have a lot of patients who may have blood disorders, whether it's anemia, it could be sickle cell, it can be different types of cancers. And for some reason, it won't let me show my face right now. I apologize. And so whenever someone has low platelets or thrombocytopenia, they are at risk of bleeding. And so remember, platelets help to clot. And so if someone has low platelets, they're probably going to be bruised. Their gums could bleed easily. So when you're reading the charts and you don't understand something, go ahead and look it up. Okay, so if someone has low platelets or thrombocytopenia, we're going to use soft toothbrushes or either those toothets and swabs to help prevent gum injury and bleeding. You're not going to do anything that's going to increase their bleeding risk, such as giving them a razor or asking them to floss, because that's going to cause their gums to bleed, or they can cut themselves, and we will have a injury. And just like with the patient with an arterial injury, you're going to have to apply pressure for a long time if these patients get injured and or if they fall. So just be very careful with somebody who has low platelets. Question 19. When measuring orthostatic vital signs, what defines a positive orthostatic hypotension finding? Is it A, an increase in heart rate by 5 beats per minute? B, no change in blood pressure with position change? C, an increase in the systolic blood pressure by 10 millimeters of mercury? Or D, a drop in the systolic blood pressure by 20 millimeters of mercury, or diastolic blood pressure by 10 millimeters of mercury? Hold on, where is she? Where is she? Where is she? Good luck on your tests, Candace. I am so proud of you all. You are phenomenal. You know that orthopedic hypotension, or excuse me, orthostatic hypotension, the blood pressure drops with position changes. And so, yes, D is the correct response. And so, the rationale is that this drop in blood pressure upon standing indicates orthostatic hypotension. All right. And so, now that you noticed it, you took the blood pressure with the patient standing, you took the blood pressure with the patient sitting up in the bed, and then you stand them up and you hold on to them and you take their blood pressure with them standing up and it drops. You're the CNA, you're in the room by yourself. What do? You get them back in the bed and you call the nurse. Keep the blood pressure cuff on their arm. So, yes, put them back in the bed. Do not get them up. Candace, you are going to be fine. Pray. Make sure you eat you some good breakfast tomorrow, or at least take a banana or something with you, and you're going to do well. We know you've been studying. All right, question 20. A CNA is assigned to a patient with neutropenia. What action is correct? Is it A, allow the husband to bring, they should say bring, a fresh bouquet of flowers into the room to cheer the patient? B, use strict hand hygiene to provide before providing care? C, encourage raw fruits and vegetables for added vitamins. Or D, allow multiple visitors without masks to reduce isolation stress. So I'm making sure that you understand your key terms. What does neutropenia mean, or what does neutropenic precautions mean? Because if you don't know your medical terms, it's going to be hard for you to answer these questions correctly on your test. But we have a playlist for that too. So, again, there's no reason for you to fail your CNA or your PCT examinations, because pretty much any question I could think of, I have created so I can help you pass your test and get to work. I want to see you out there working and helping to take care of others. And so, whenever a patient has neutropenia, their white count is usually low. Remember, white blood cells, they fight infection. And so this person's going to be on reverse isolation because they can catch conditions from us. So we actually make them sick. And so the answer is going to be yes, it is B. So the type of person who would be on neutropenic precautions is most likely a patient who is on chemotherapy. So we have to provide proper hand hygiene to prevent infections. And when they're on reverse isolation, we don't bring those outside things in the room. We don't bring fresh flowers and raw foods because they could carry bacteria. And then, of course, the patient's family members, those visitors, and plus the hospital staff, they're going to have to gown up, mask up, glove up, not because the patient is infectious, but because the patient can catch whatever we bring into that room. Question 21. A CNA is transporting the patient to the MRI department. Which item must be removed before the patient enters the MRI room? And I put this on here because this just happened. It happens usually once or twice a year. So you are transporting the patient to the MRI room. You have to be vigilant. Which one would you not take? Is it A, the plastic IV pole labeled MRI safe? Would you remove the patient's blanket? Would you remove the patient's hospital ID bracelet? Or would you remove the metal necklace and jewelry? What must come off of you and that patient before you enter the MRI suite? Thank you. Everybody got it right. Bobby pins too. I mean, things we don't think of. So you really want to make sure that you and your patients are safe. So the answer is going to be D. I don't want you sucked into that machine. I don't want your patient injured. And so MRI machines use powerful magnets that can pull items like jewelry, watches, and clipboards into the scanner, creating a dangerous projectile hazard. Only MRI safe equipment should be allowed inside of this room. Question 22. Which of the following actions is appropriate if a PCT identifies a flat line, asystole on the cardiac monitor? Is it A, administer epinephrine immediately? B, begin chest compressions without assessment? C, verify lead placement and assess the patient's pulse? Or D, silence the alarm to prevent patient distress? So the heart monitor is flat, just a flat line. You're at the nurse's station, and that's what you see on the central monitors. What do you do? That is right. I see so many answers. The correct response is going to be C. We don't panic just yet, but we are going to go to that room swiftly because maybe your patient took off their leads. Maybe they were transported to a different area. Maybe they went to physical therapy and the physical therapist forgot to tell you, hey, we need to take off this telemetry monitor. And so a flat line could be due to lead disconnection, and so you go in, you assess that patient really quickly. Hey, are you okay? If they're talking to you, they are not flatlined. But if they are unresponsive, it is immediately pulse, carotid pulse, and looking at their chest rise and fall for 10 seconds before you reach overhead. You hit that panic button, and then you're going to lower that rail and start your CPR in the bed. You will start CPR. The beds have a CPR mode, and if you don't know where that is, it's usually beneath the top mattress. It's going to be a lever that you can pull or a button that you push. And what the CPR mode does is if your patient's sitting upright in the bed and you activate that mode, it flattens the bed instantly. So you don't have to press the button, lower the head of the bed down, and it starts allowing the air to escape the mattress. So you don't wait for a backboard. You don't wait for your team. If your patient's in cardiac arrest, You hit the button to call for help, lower the rail, hit the CPR mode button, and start your compressions in that bed. All right, so question 23. A CNA is providing care in a CNA is providing care in a patient's home and notices the pill minder, that's what we call it, is a pill organizer. You notice that it's empty. What should you do as a CNA? Is it A, refill the pill minder with the patient's medications? B, call the pharmacy and request refills? C, notify the nurse or family caregiver that the pill minder needs refilling? Or D, ignore it since it's not part of your job duties? You all are so super smart. Yes, it is a C. Yeah, you can't do anything about that. And so with the pill minder, what you do is if you're the CNA in the house, you can hand them their pill minder. All right, Mrs. Lucas, it's 2 o'clock. Here's your pill minder. Go ahead and take your 2 p.m. or your afternoon meds. That's what you can do. You can't physically touch a pill, but you can hand them their pill container. So if you go in the house and you realize that that container is empty, that is a nurse's duty or that is the family member's duty. That is not something that you can assist with. So if the family member isn't there to do so, then yes, you'll be notifying your nurse while you're in the home, letting them know that, hey, somebody needs to come out and attend to this patient's medications. 24. When performing a finger stick glucose test, which of the following steps is necessary to ensure accuracy? Is it A, squeezing a fingertip vigorously to obtain blood? B, using the first drop of blood collected? C, puncturing the center of the fingertip? Or D, warming the finger before puncture? And then when we get to question 25, I want you all to be thinking about it in advance. I want to know what you want the next video topic to be because I get new interns soon, and those new interns are going to help me create these slides and these presentations. So be thinking about it. Don't put it in the chat just yet. But the answer to question 24 is congratulations, Asana. All right, so the answer is going to be D. It is not B. We don't use the first drop of blood. We wipe away the first drop of blood. That's because it could be contaminated with the alcohol. And so it's going to be D. Warming the finger before the puncture helps to improve blood flow and it ensures an accurate reading. All right, and then let's go to our last question. And thank you all for studying with me. I'm so proud of you, and congratulations to everyone who has passed their exams. I think we had half a dozen, if not more. And so, question 25, a CNA is assigned to check the blood sugar of several residents in a long term care facility. Which practice best prevents the spread of infections such as hepatitis B? Is it A, use the same lancet and clean it between residents? B, clean and disinfect the glucometer between each resident use? C, share the same glucometer without cleaning if residents are related? Or D, wear gloves only if the resident has visible blood on their finger? And so the glucometer, the term that you may know it as, is the AccuCheck machine. But not all glucometers or devices that read blood sugars are made by AccuCheck, which is a brand. And the reason why I included this particular question is because there was just a report that came out that a patient contracted hepatitis B from the glucometer. And so that immediately told me that either the CNA or the nurse did not do B. And so the correct response is B. You have to clean the glucometer. You have to clean the lancet. Hepatitis B is not just transmitted by visible blood. It could be the fecal matter that is on the resident's hands because you didn't clean their hands before you did the finger stick. And so hepatitis B can be transmitted if blood contaminated equipment like glucometers is reused without proper cleaning. Each resident must have their blood glucose checked with a new lancet, that's the piercing device, that's a little small needle, and a clean, disinfected glucometer before reuse. Gloves should always be worn regardless of visible blood. And so make sure you're cleaning the exterior of the equipment before you take it into another patient's room. And guess what, team? You know how much I appreciate you all, and I thank you all. I think there were close to 100 of you studying with me tonight just on YouTube, and of course we have Facebook also. And so Okafor has put his comment in, or her comment. Okafor says the promotion of safety. Can you give me like an example of what you're talking about? Are you talking about like fall preventions? Because safety is it's a lot of different safety topics. So I want to make sure I'm giving you what you want, Okafor. And as we say in each of our videos, remember that caring CNAs make caring nurses. And so you're doing this the right way. Don't just rush off to nursing school. Some of you all want to just, oh, I want to go be a nurse. You don't even know what department you want to work. And then a lot of your new grads don't have jobs. And the reason they don't have jobs is because they don't have any connections within the hospital. So you working as a CNA is going to help you network. It's going to help you learn if you even want to be a nurse. It's going to help you learn your terminology. It's going to help you learn your skills in nursing school. If you can't pass your clinical checkoffs, the skills, you get kicked out of nursing school. And so doing it this way, I think it helps. It helps you to become a better nurse. It helps you become more prepared, and it helps you determine which units you want to work on. And once you're working in that hospital, they help with tuition reimbursement. When I say hospital, also nursing homes. And so I want to say how much I thank you. And I'm going to be looking in the comments right now. Let me show the comments so I can see what topics you all want me to teach. All right. And yes, of course, thank you for watching. So Okafor says, so Candace, any tips for your test tomorrow? Um, did you go to, well, like what kind of program did you go to? So I don't want to be telling you things that you already know. So it's kind of too late at this point for me to giving you tips because I think that's going to boost your anxiety. So what I want you to do instead is I want you to find a way to calm your nerves so you can get some sleep tonight. Um, I know it's going to be hard, but I need you to get some rest. I need you to eat breakfast. I need you to arrive to your test site on time. And when you're at the testing site, don't become anxious. It's going to be a lot of people who are going to be there. Some test sites can test as many as 16 people. And so I just want you to be calm and to be confident and to know that what you've already been studying, what your professors have taught you, know that that was the right material, and don't get distracted by what's going on in that testing site. In Florida, if you make a mistake while you're doing your clinical skills, you can say the word correction. And okay, and then also with your clinical skills, one of the main reasons that people fail is from hand washing. So make sure you wash your hands before your skill and wash your hands after your skill. But if you have a specific question, please put it in the chat. But I just want you to calm your nerves because tomorrow is test day and I know you can do it. And I wish you much success. All right, let's see what else you all have. Okafor, he wants a video on falling. Got it. Yes, we'll get that done. All right. Your Prometric test, you're going to do fine with Prometric. That's the agency that most of our students test with. All right. Okafor. So anything regarding safety, it could be aspiration precautions, fall precautions. Got it. And then Barry Jean, congratulations on passing your examination. All right, and so I don't see any. It looks like Okafor, you have it. And so in my interns, when they come back next week, I will make sure that we start doing those videos on fall precautions, and I will try to hire a patient actor. That patient actor would be someone who would pretend to be a patient, and maybe we can do some scenarios. So not just questions, we can do videos that talk about how to handle the situation when a patient falls. All right. Yes, Mrs. Ray, this will still help you regardless of where you're located. The questions are based off of I won't say global, but most countries use what United States puts out. So the questions are based off of national content. So I'm not teaching you something. We talk about incontinence the same way you're going to prevent incontinence in Florida is how you're going to prevent it in Virginia. You're going to take your patients to the bathroom more frequently. A CNA cannot insert a catheter in Virginia. They cannot insert one in Florida. So our questions are going to help you regardless of your location. Our skills will also help you. However, I need for you to go back and review your school's book, your state's requirements, because in Florida you can give 3 bites of food during the feeding skill, but what if your state requires 5? So the general techniques are the same, but some states may just put in some extra criteria that I may not be aware of. But with that being said, we have students and viewers from all around the world who use our videos and pass. So I wish you much success. All right, let's see what's left. All right, everybody. Jacqueline from Metric to take the test. Jacqueline, go ahead and help me understand your question. From Metric to take the test. Ooh, I don't understand your question, dear. I apologize. Oh, there we go. How long does it take to get an answer from Prometric? It's based off of the board of nursing. So the board of nursings are backed up. Everyone's working short staffed. And so in our area in Florida, it's taking about 3 to 4 weeks. We don't have our students wait for Prometric. We have our students proactively check their status. You can go to Prometric's website, you can check the status, but you can also give them a courtesy call. But usually they're going to say the late is the board of nursing, and they're not lying because they cannot give you a test date until the board of nursing has looked at your background report and actually said that you are clear to test. And so that is some of the delay with Prometric. And then Jonathan, your exam is September the 12th. We know you're going to do well. And that's Jonathan, not Jonathan. I do apologize. And we'll do about 2 more questions. Let's see. Next video, promotion of safety and emergency, please. Got it. And then Jacqueline, you're in Florida as a testing, Orlando as a testing site. You're going to do well. Just watch our videos and then do whatever your instructor says. If your instructor says something different than our video show, I'm always going to say go by your instructor because I don't know you and I don't want to cause any confusion with your instructors, but I do know that our students pass their exams. All right, everybody, it is 9:51. Nurse Eunice is going to bed. I love you all. Good luck on your test, and I'll see you in the next video. Bye, everybody.